Hello, this is Dr. Gay from First Sec MRI, and this is a 15-year-old female gymnast with complaints of right hip pain. On this large field of view image, we can see both hips. We see the left femoral head. This round ball looks great. We see the growth plate here, not fused yet, looks normal. On the right-hand side, we see there's asymmetry. Instead of having a nice round contour with nice bright fatty marrow, we see this flattened contour. We see this dark irregular band beneath the articular surface. And so this looks like avascular necrosis, where there's not a great blood supply to the top of the femoral head, so the bone is dying, and it has this bone sclerosis beneath the articular surface. And also they have marrow edema here. Looks like some marrow edema has gone down into the femoral neck. And one more thing. This is another view. On this view, you can see there's an associated joint effusion. This white is fluid in the hip joint. Again, we appreciate the nice, beautiful contour of the left side and this flattened contour on the right in the low signal, the dark area beneath the articular surface. So in a child, when you see avascular necrosis, it could be from prior trauma, it could be from some prior infection, it can also be idiopathic, related to leg calf Perthes disease. That's usually younger people though, more like between 5 and 8 years old. So this patient is 15, so way too old for that, but maybe they had some chronic Perthes disease, and this is just residual, but with the patient being a little bit too old for the idiopathic spontaneous or the idiopathic osteonecrosis, and the patient having a history of microtrauma being a gymnast, is probably related to that. Now there's one other very significant finding here. If we put up a sagittal view here, so in this sagittal view, I put some arrows. This is towards the front, back, we see a line of fluid. Looks like this is the cortex or periosteum here over the top, and there is an abnormal band of fluid. So it looks like subperiosteal or subcortical hemorrhage underneath, uplifting the cortex there. This is fluid in the hip joint. So this patient has a very serious injury of, looks like avascular necrosis, and now this fluid is dissecting beneath the articular surface, uplifting the cortex and periosteum here. And so they need to get with their orthopedic surgeon quickly for some treatment advice. Luckily, they did not have any slip of the growth plate here, so there's no capital femoral epiphyseal slip, which is one thing to think about in these patients if they have AVN or something looks funny up here. The slipped capital femoral epiphysis is usually in males a little bit older, like 12 to 15 years old. This is a female, and usually those patients tend to be more obese. This is a gymnast, it's not obese, and we don't see the slip, so that does not correlate very well with that. And if you do see AVN when someone that doesn't have a case like this where they have significant microtrauma, then you can think about SLE or steroid use or some other cause for avascular necrosis. And so that's it, an unusual case of, it looks like AVN of the right hip in this gymnast, and also the subperiosteal fluid collection here, this uplifting the articular surface, the articular cortex or periosteum here, and an associated prominent or moderate sized joint effusion. And that's it. Thank you so much.